Thank you so much for having us, Heather. So I'll just briefly introduce myself and Emma, and then say a little bit about our work, and then I'll get into the presentation. My name is Johannah Black, she, her pronouns, and I work primarily at the Antigonish Women's Resource Center and Sexual Assault Services Association, which is a independent center for women, but also for trans and non-binary people. And part of the work we do is around sexualized violence and bystander intervention. And so my particular role there is the bystander program coordinator. And in that role, I've developed the Waves of Change bystander intervention training program, which is a 5-module training program in partnership with all of the universities and the NSCC in the province of Nova Scotia. And I also teach Intro to Women and Gender Studies at St. FX University. And I will allow Emma to introduce herself. So Emma.
I'm Emma Kuzmyk. I also use she, her pronouns. And this is my second year working on the Waves of Change program as Johannah's summer student. I really enjoy doing the work. During the school year, I'm also a facilitator for the program, so I know it pretty well. I'm going into my last year at St. FX, and I'm happy to be here.
And Emma is also a 3M scholar, so very lucky to have her on this project, and an accomplished artist. So she's done all of the artwork for the program, which I am so grateful for because I do not have artistic talents. So yeah, Emma and I, at the beginning of the pandemic, we noticed and read in the news about a predictable rise in gender-based violence, misogynist violence, relationship violence that would come with the isolation that happened with a lot of the COVID response measures. And so we decided to take some of the knowledge that we have about bystander intervention that we've developed through our Waves of Change training program, and we put together a zine with some suggestions for how to practice community care during the pandemic and to reach out to those who you might be worried about. And this kind of got us started thinking about what community care might look like in the online sphere. So with this coming fall, we know that our campuses aren't going to look like they did in the past. Our campuses will not be functioning in their usual manner when we return in September. Whether students, faculty, and staff return to campus or engage in online learning or some mix of both, we know it's going to be different across various institutions. Both the campus experience, it's going to be significantly different from previous years. Some students are going to be forced to quarantine alone in dorm rooms for 2 weeks upon returning to campus or coming to campus for the first time. We know that coming to a new campus, a new town, even a new country can be an isolating experience in the best of times. And now that's also going to be with 2 weeks of isolation in a dorm room. As someone who got sick in undergrad and had to spend a few weeks alone in my dorm room, I can tell you it's not a pleasant experience. We also know that mature students with children are going to be facing significant disadvantages, but they are not alone in this struggle. International students or out-of-province students will be arriving to a completely new environment where they might not be 2 isolating weeks of quarantine. Some students might be staying at home and will be facing the added burden of care work for younger siblings, elders, or disabled or sick family members because of parents who are working essential jobs or parents who are in jobs that put them in contact with people with COVID patients, and therefore they have to isolate from the rest of the family. So there's going to be a wide variety of challenging situations for both our students and our faculty and staff. While there has been significant opening of businesses and few active cases in the Atlantic provinces, we know that not all of our students live in the Atlantic provinces or even in Canada. And we also do not know if there's going to be a second wave, what it might look like, and what measures will need to be put in place if this does happen. There are so many unknowns, and there will be a wide range of serious challenges facing students, faculty, and staff on and off campus that we will need to respond to and be sensitive to. We cannot simply go on business as usual. So today, Em and I are going to be talking about community care and some of the ways that we can integrate the principles and practice of community care into our campuses. We have heard much over the past few months about the importance of self-care and various tips and practices that can improve our self-care. And while these discussions are important and can certainly be helpful to some, they're often quite individualistic and can leave us feeling even more isolated in very isolating times. The principles of community care include finding creative ways that we can come together as a community in small groups, as friends and neighbors, as colleagues, in order to address broader problems. Community care means finding ways to encourage and create connections and relationships between people. Community care means that no one should ever feel that they have to face difficult challenges on their own. In times of quarantine, isolation, social distancing, and mask wearing, it might feel like community care is impossible or extremely difficult. However, there are many novel ways that we can use technology in order to bring people together and reach out to those in need and support each other. So, what are some of the challenges that students will be facing? And this is by no means an exhaustive list. This was just a few things I could think of off the top of my head. We know that due to COVID-19 and the quarantine restrictions that were put in place for the first couple of months, there have been increased rates of intimate partner violence and other forms of violence in the home. There have also been major increases in mental illness due to the stress and uncertainty that has come with this virus, including the stress of losing jobs or working in jobs that put one at risk of contracting the virus, the stress of financial uncertainty, of facing eviction in some cases, of being separated from loved ones in different provinces or countries, and in the lack of in-person mental health supports or even physical health supports in many places. There's also the grief that comes with losing a loved one to the virus, or the sometimes debilitating and long journey to recovery from the virus, even for previously healthy patients. Increased stress, grief, and isolation are a bad combination and put many people at risk for anxiety, depression, and other mental illnesses, as well as increasing the risk of abuse and violence in the home. There have also been reports of racist harassment and violence in the streets and and violence against people who might look Chinese or who are Chinese. All of these things, violence in the home, racist harassment or violence in the streets, increased stress, all of these things can significantly impact job performance and academic success. they also have the potential to become cyclical problems, where isolation increases lead to violence in the home, which leads to further feelings of isolation when survivors don't know where to turn or where to reach out for help. In another example, a Chinese international student could arrive to a new country and a new campus, already feeling isolated, experience racist harassment on campus, leading to further isolation and withdrawal from campus life. So I bring up these cyclical patterns because community care means using various types of intervention in order to break these cycles. While it does work best in person, it is also something that we can engage in through online through technology. So as I mentioned at the beginning of the pandemic, Emma and I created the Community Care During COVID-19 zine as a way of encouraging thought and discussion on this topic. So the zine was specifically looking at interventions when people are experiencing violence in the home, or if you're concerned that someone's experiencing violence in the home, but you might not know for sure whether or not that's happening. However, the same principles could be applied to reach out to others when we're concerned about their mental well-being, or if we're concerned that they're experiencing racist harassment or violence. The same principles could be used in a wide variety of situations where you might want to reach out to someone. So the main idea in the zine and behind community care is to find ways to move beyond the discomfort that we often feel when talking about these tough topics, and to gently open up dialogue and conversation around these topics with the people around us. We believe that open conversations between people who trust one another, rather than silence and isolation, are the best way to approach these broader problems. We know that it's difficult for most people to discuss many of these topics, and even more difficult to reach out for help. This is why it's so important to think creatively and to go beyond merely asking, "How are you?" or saying things like, "Make sure you come to me with any concerns." The problem is that it's so hard to reach out that most people, even if you say that, aren't going to reach out. Or if you say, "How are you?" I think all of us can think of a time when someone's asked, "How are you?" and we've said fine, but we're not really fine. It's a very common experience, right? So in the zine, we address this by offering gentle probing questions that you can use to open up conversation on things like relationship violence. So maybe, Emma, you can pull up the zine right now and we can show a couple examples.
So this is the Bystander Intervention Community Care zine that we've been talking about, and it can be found online. It's free. We've included a link at the end of the presentation where you can access it if you like to. And basically, kind of what Johannah was talking about, that in this zine you'll find suggestions on how we can work together in our communities, families, and friend groups to break the silence on gender-based violence. Not an exhaustive list again, but it does kind of help to get ideas and conversations flowing. So here's some of what the pages look like, talking about how to check in, providing some different options of conversation starters and how you can reach out to people that you think might be in danger, or people that you might think just need an extra hand in life. To ask probing questions. Sorry, I'm going through this pretty quickly. What to do if the person doesn't want to talk. So you can say things like, "I just want you to know that you can call me or text me at any time to talk about anything. You're not a burden to me. I enjoy talking to you." A couple different examples. Then going further, what to do if you suspect a friend or loved one is in danger. And then other tips as well. That was really quick, but there's basically an introduction to the zine, which can be found online.
That was really good. Thank you so much. So as you can see, we tried to break it down into common kind of scenarios as a step-by-step with just some simple suggestions of things that you could say, as well as some other tips there at the end. And the important thing is really finding ways to make it normal to talk about relationships, the important relationships in our lives, to encourage people to talk about things like mental health, and to make these an everyday topic of conversation, because that's going to make it much more likely that people are going to feel comfortable to talk about these things when something does happen. So I've also tried to think about this in my teaching, what this might look like. What might community care look like in the classroom? So it's different for so many of us, I know, but my own year this year is going to be teaching a 3-hour class online. And so there's a number of challenges when it comes to community care. I teach Introduction to Women and Gender Studies. We spend a significant amount of time talking about gender-based violence, sexualized violence, and it's typical throughout a year that I receive multiple disclosures of violence from students, and it's a lot different being able to sit down with them in person and talk about these, and to recommend or to refer them to in-person therapy or counseling, or to hand them resources, than it is to, have a chat online. I'm not sure what that will even look like. And so I wanted to think proactively about building in certain aspects of relationship building and community care into my teaching. One thing I know is that 3 hours is definitely, in my mind, way too long to sit through an online lecture. So, and normally with my in-person lectures, I break them up by doing group work and a lot of discussions. That's going to be harder to do online, but also, the exhaustion that comes with looking at a screen for 3 hours, it's really going to make that difficult. So some of the things that I've thought of are encouraging some individual work through things like journaling. These journals would be basically like a way of getting participation grades. So they wouldn't so much be graded on the content, more that the work was being done. And they would have a 3-hour period to get that done. And I was thinking the very first day, the journaling prompts I could ask is for them to describe their living and learning situation for the year and any concerns that might impact academic performance or well-being. And I thought this might be a good way just to encourage students to start thinking about what their year is going to look like, or what they anticipate is going to look like under COVID-19, and how that might impact their learning. And then that way, that might help to address any concerns early on, to offer resources early on in the year. But even if they don't open up in that first journal entry, it at least sends out the message that I am someone they can talk to about this, that these concerns are welcome as something they can share. Another thing that I've been thinking about is holding kind of regular one-on-one meetings with students during that 3-hour period. So finding a way to divide up all of the students that I have and meet with a few each week, so that I am able to kind of get to know them a little bit better, and kind of get their feedback and see how the course is working for them. I know it's often difficult for students to ask questions in front of their peers and admit when they're having trouble with the material or not understanding it. And part of the way that I address that in person is through those that group work and those group conversations. Once they get more comfortable speaking in a small group amongst their peers, it's a little bit easier to speak out in the larger group with the full class when we come back together. And that's always been a really good way of encouraging participation. That's going to be a lot harder to do online. And there are a lot more fears that come with participating online because of things like online bullying, people being able to take screenshots or even Photoshop, take a screenshot and Photoshop someone's face on something, record something without the other person knowing. So there are a lot of concerns also with online harassment and violence. So there are going to be so many challenges that we face. So I just wanted to offer these couple examples before we get into our discussion. So we have 3 questions for discussion today. The first question is, what challenges do you foresee students or even faculty facing as a result of COVID changes? And we'll try to keep our discussion of challenges limited to those things that can in some way be affected by community care. So things that we can respond to with community care principles or practices. The second question is, what are some strategies or practices that you've thought of that you can incorporate into your teaching in order to encourage community care and connection with students, whether you're teaching in person or online, because we know that there's and then finally, what are some broader campus level strategies or practices that we can use in order to create a greater sense of care and connection amongst our students or even amongst the broader campus community? So I think Heather, the host, is going to put us all into breakout groups and we can discuss these 3 questions and then come back together as a larger group.